Namaste everyone, I am Dr. Amit here. Hope you all are doing well. Welcome back to my YouTube channel at the rate Dr. Amit Official on YouTube. So it's a learning platform for NMCL exam, USML exam, MBBS exam and postgraduate entrance exams. So over here we actually simplified medical subjects in a simple language. So if you haven't subscribed it, make sure to hit that subscribe button and stay connected for more easy and exam oriented videos. So in our last video from biochemistry series, we talked about cystinuria. Now we are moving forward in our biochemistry series, and today we'll discuss on an important clinical topic called organic acidemia. And this is a key exam focus topic for USML exam, PG exam and MBBS university exam. So I'll explain it in a simple, clear and easy to recall way. So let's dive in and get started with our topic, organic acidemia. So while talking about organic acidemia, so let's first understand what is this. Okay, so organic acidemia are inborn error of metabolism. Okay, so it's an inborn error, right, of metabolism of what, where amino acid cannot be broken down properly, okay, and leading to accumulations of organic acid in the body. Okay, the last video in cystinuria we saw that some amino acids are not getting reabsorbed, but over here there is an inborn error of metabolism where amino acids are not be broken down properly. Okay, like in maple syrup, urine days also we saw that the branched chain amino acids are not getting degraded properly. Okay, so same over here, that it's not getting broken down. Okay, now the basic concept. Okay, so basic concept is first problem is defect in amino acid catabolism, that is degradation. Now what does it result? So if the amino acid will not degrade, or the catabolism process will not occur, then it will accumulate in the blood. Now what causes? So if it accumulates in the blood, then it will causes what? It will cause metabolic acidosis, and it will be high in ion gap metabolic acidosis. Okay, increase in HCO3 level. Okay, remember this is high in ion gap metabolic acidosis. Then that accumulations of amino acid will be toxic to brain, so it will cause toxicity to brain. Now what will be the common presentation in infancy? So it will the infant will come with poor feeding, vomiting, hypotonia, the tone of the body will decrease. Then there will be high in ion gap metabolic acidosis, hepatomegaly, that is increase in size of liver and will cause seizure. Okay, now the organic acid accumulations. Okay, we all know that because there is no degradation or catabolism of amino acids, then there will be accumulations of amino acids. Then this amino acid will inhibit gluconeogenesis, and we all know gluconeogenesis is very important in the fasting state to get glucose from non-carbohydrate source. So it will inhibit the gluconeogenesis, then that will decrease the fasting glucose level and it will cause increased ketoacidosis. Okay, the one problem is this. The second problem is inhibit urea cycle. If there will be no urea cycle, then the ammonia will not get converted to urea. Then there will be accumulations of ammonia in the body, and it will lead to hyperammonemia, that will cause flapping tremors, slurring of speech, somnolence. Okay, this all. Okay, now let's see over here. Suppose this is amino acids. Okay, protein metabolism. Okay, so just remember this mnemonic: vomit. Okay, valine, odd chain fatty acids, methionine, isoleucine, threonine. All are these all are what? Valine, methionine, isoleucine, and threonine are essential amino acids. So it is getting converted to propionate. Okay, and then propionyl coenzyme, then methyl malonyl coenzyme, then succinyl coenzyme, and this succinyl coenzyme will take part in TCA cycle. Okay, and over here two enzymes are being used. Okay, and over here biotin, and over here vitamin B12 is getting used. Okay, now let's see what's the problem actually occurring. Okay, so when we'll see over here, so one is propionic acidemia and one is methylmalonic acidemia. So in propionic acidemia, there will be deficiency of propionyl coenzyme carboxylase. Okay, so now see in this image. Okay, this propionate is getting converted to propionyl coenzyme, and then it is getting converted to methylmalonyl coenzyme, and over here the enzyme which is used is propionyl coenzyme carboxylase, and this enzyme is deficient. So if this enzyme is deficient, then this will not form, and when this will not form, then it means it will accumulate in our body this propionyl coenzyme. So that's why increase propionyl coenzyme. And if this will not form, then this will decrease the methylmalonyl coenzyme, methylmalonic acid. Okay, so this is all about propionic acidemia. Now while talking about this methylmalonic acidemia, so there will be deficiency of methylmalonyl coenzyme mutase or vitamin B12. Okay, now look, this propionyl coenzyme is getting converted to methylmalonyl coenzyme, and that will getting converted to succinyl coenzyme. So to convert this methylmalonyl coenzyme to succinyl coenzyme, we are using the enzyme methylmalonyl coenzyme A mutase, and this is deficient in case of methylmalonic acidemia. Okay, so this enzyme is deficient. Now in both cases, what will be the clinical feature? So we have already learned the clinical feature will be vomiting, poor feeding, seizure, yes, then metabolic acidosis with high anion gap, then increased ammonia level, hyperammonemia. Okay, so this will be the clinical feature in this both acidemia, right? Now how to diagnose this case? Okay, so to diagnose this case, we will see the plasma amino acid level, then urine organic acid level, and we'll do blood gas analysis. Why blood gas analysis? To see which type of acidosis or alkalosis. So we'll find metabolic acidosis with high anion gap. Now coming to treatment part, what we'll do now, we'll give low protein diet. Okay, so that this organic acidemia will be low. Now we'll give IV glucose to prevent catabolism, right? Now then in severe cases we can give what? We can do in severe cases we can do dialysis. Okay, now in specific cases we can give biotin or vitamin B12, because these both are being used in the steps, right? So this is all about organic acidemia. Okay, so if you like this video, please do like, subscribe my YouTube channel, and share with your fellow medicals, and also share in your medical college groups on WhatsApp or any app. Okay, and this is all about organic acidemia. You can solve now any MCQs, I think, in any competitive exam. Okay, so go and practice MCQ on organic acidemia, and just remember these features. Okay, because because nowadays the examiners make all these features in a single vignette, and they'll give a clinical scenario. Okay, so that's all about this. So keep studying hard, and we'll make in the next video on some important topic again. Till then, keep studying. Bye.